Before we dive in, I just want to share the different perspectives that I'm bringing to this presentation. So, as Megan mentioned, I'm a child and teen therapist, and one of my main specialty areas is anxiety. I'm also someone who has suffered from anxiety my entire life. And most importantly, I am a new mom to an 8-month old baby boy. So while I have only just dipped my toes into the world of parenting myself, I've already experienced how my perspective on the world and my work and even this topic has already changed. So I'm going to start off by just giving a brief overview of the current state of our kids' mental health to give a little insight into why I'm referring to it as a crisis. So let's start with some statistics. A recent study reported that anxiety and depression doubled in children during the first year of the COVID-19 pandemic. This graph shows how anxiety and depression have been rising fairly steadily, but with a pretty large increase starting around 2012. And then another big jump at the start of the pandemic. A 2021 CDC survey of US high school students found that the suicide rate is up 60% from a decade ago. 30% of girls said that they'd seriously considered attempting suicide, which was double the rate of boys. And almost half of the LGBTQ students said that they'd also considered suicide. So, very, very scary stuff. It is important to note that it's difficult for us to understand the full effects from the pandemic at this point because the majority of the research is still in progress. The pandemic is an obvious reason why kids are struggling more right now, but why has there been such an increase in anxiety and depression that started before the around that 2012 mark? So that's what we're going to be focusing more on tonight. And I just want to end this slide by sharing why I chose to talk about anxiety. Yes, I'm passionate about it. And yes, because it's been increasing, especially in recent years, but also because it's often misunderstood or not taken seriously. And it can impact the entire family when a family member is suffering with anxiety. It's also one of the most common mental health disorders, but one of the most treatable. So, to start, we're going to play a little game of true or false to test your knowledge of anxiety. So, feel free to just kind of play along and let's get started. So, the first one, anxiety's main job is to keep you safe. This is true. When faced with danger, your body goes through lots of changes in order to get you ready to protect yourself. Anxiety has evolved to keep us out of danger, but also to obey the rules of our group and to treat each other with respect. You can stop your child from feeling anxious. False. Even though you want to keep your child from feeling anxiety, you can't. You can, of course, learn strategies to help them manage it. And you can also help them change how they view anxiety as opposed to changing if they feel it at all. Anxiety is an emotion. True or false? Ooh, I see lots of thumbs up. Okay. True. Good. I'm impressed. I myself didn't even know that until not too long ago, honestly. So, yeah, a lot of people don't know that anxiety is an emotion. Mhm. Not all anxiety is the same. Oh, lots of thumbs up. Yep, true. There are different types of anxiety, and sometimes it can be hard to know what type someone is experiencing, right? Some anxieties are short term and situational, some are long term and more general, and others can be sudden and inexplicable. So, on top of that, to make it even more complicated, everyone experiences anxiety a little bit differently. If you're an anxious person, there isn't much you can do to change it. Ooh, lots of thumbs down. You're correct. Yep, it's false. If anxiety is a problem for you, there's a lot that you can do. You can learn to take control of your anxiety and implement different coping strategies to help you get through those anxious moments. All right, and the last one, telling yourself to relax is an effective way to deal with anxiety. Ooh, see a lot of Thumbs down. Good. This is false with a capital F. When you struggle with anxiety, it's not as simple as just telling yourself to relax, or even worse, telling somebody else to relax when they feel anxious. And if any of you struggle with anxiety, you know that that tends to not be very helpful. So, I want to talk a little more about what anxiety is. So, the definition of anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. What happens is when a person perceives a possible threat, it enters in through our senses, what we hear, what we see, what we smell, and an unconscious reaction occurs to prepare the body and mind to respond. This is known as the fight, flight, freeze, and collapse response. Then this information activates part of the amygdala in our brain, which is the emotional control center. So, this one you can kind of picture like the inside out control room. That's essentially what the amygdala does. And this initiates the behavioral reactions required to deal with the threat. So, while a normal amount of fear and anxiety are normal, an overexposure to fearful or even just stressful events has the potential to result in causing the fear pathways to become overly sensitive. And when this happens, it often results in the development of fear based mental health disorders like anxiety. And sometimes the brain misinterprets threats and misfires. So, this may be why your young daughter sees someone not texting her back as anxiety provoking, because the brain is misinterpreting that as a threat. Anxiety is how we respond to feeling threatened, but it's also how we can respond to feeling under pressure or stressed. For example, if our kid has a big test coming up, or we have a job interview or a doctor's appointment. So, anxiety isn't necessarily a bad thing. It can help us stay alert, make us aware of risks, and motivate us to solve problems. While experiencing occasional anxiety is a normal part of life, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. So, the difference between normal anxiety and an anxiety disorder really comes down to functioning. If your child is struggling on a daily basis to function within friendships, school, family, or even struggle to take care of themselves, these are all signs that may point to something more serious going on. And something that we often see is people who don't know what anxiety can really feel like in their body may end up going to the emergency room or their primary care doctor and saying something to the effect of, I think I'm dying, because anxiety can cause extreme physical symptoms if you're having a panic attack or an anxiety attack, especially. This actually happened to me as a teenager, and I was told to take ibuprofen from one doctor and referred to a therapist by another. So it's important to understand just how physical anxiety can be. As you can see in this graphic, it lists quite a few ways that anxiety can present. Children process information differently than adults do, right? They're not just mini adults. They can't process their world actually in the same ways that we can because their brain isn't fully developed. And this affects the way that their minds identify and respond to potential threats. When children are anxious, they need connection to the emotional center of the brain, which is in the right hemisphere. So, if your child is experiencing anxiety, you want to focus on feelings over logic or reasoning. When you explain to them why their fears are irrational, for example, it's just a little spider, there's no need to be scared, you are connecting with the left hemisphere or the logical side of their brain. And this isn't going to be helpful because the logical side of their brain isn't developed enough yet for this understanding. Part of the brain that actually isn't fully formed until we're at least 25 years old. Plus, emotions simply aren't logical. Next, we're going to talk about how anxiety presents in children and adolescents. What does it look like? These are some really common anxiety symptoms that kids at really any age may experience. Anxiety in younger kids typically presents as more of the behavior problems like anger, irritability, tantrums. And when kids this age are struggling internally, it typically comes out in their behavior. So, younger children are prone to be anxious about external things like animals or monsters under the bed, or a really common one is something bad happening to mom and dad. And if they're experiencing anxiety, you'll often see a preoccupation with what if questions, especially things that are unlikely to happen. Like if there's a big storm outside and it's raining a lot, they may say something like, "What if there's a flood and our house washes away?" So at each stage of development, kids have different worries and vulnerabilities. As kids enter their teen years, they're more able to differentiate themselves from others. And this starts to happen around end of elementary school into middle school. Because of this, anxious teenagers are different from anxious children. So at this age, their relationships with their peers become a lot more influential and important. And parents, if any of you have teenagers, you know this to be 100% true. Their friends are their life. So while children are prone to be anxious about external things, teenagers are more likely to be worried about themselves, like their performance in school or sports, how they're perceived by others, and the changes happening in their bodies. So, this is a list of some common causes of anxiety based on age. And I wanted to show this because one, I think it's fascinating. But even more than that, it just demonstrates how normal anxiety is for kids to experience. It doesn't have to be a kid who has an anxiety disorder or is more prone to anxiety. This happens to every child. So I'll leave this up for just a second for you guys to kind of peek at. All right. So let's talk about some factors that increase anxiety in kids. Recently, I took a training on childhood anxiety from the Institute of Child Psychology out of Canada, and they spent a ton of time on this. It was so impactful to me as a therapist, but even more so as a parent. So I really wanted to make sure that I included this in my presentation. Okay, so the first factor, I'm going to put two pictures up one at a time. And I'm going to leave each one up for about 10 seconds. So just a short time. And I want you guys to just look at the picture, just kind of take it in. Okay, so here is the first picture. And the second picture. All right. So you may have noticed looking at that first picture of the city scene, maybe you started to feel a little tense, maybe a little stressed. Your breathing may have picked up a little bit, maybe starting to have some negative thoughts. Picture two right here of this wonderful nature scene. Maybe you started to feel a little more calm. Maybe your breathing slowed a little bit, some more positive thoughts. So the first factor is nature deprivation. So, this was meant to represent just how much being in nature can impact how we feel. Because we are designed to connect to nature simply because it makes us feel good. So, being outside is really important for our mental and physical health. And what's really scary is a recent study from 2022 says that on average, American children spend less than 10 minutes a day in unstructured outdoor play compared to 7 hours in front of a screen. So, yeah, our kids are spending less time outside than incarcerated inmates do. That's pretty shocking. So, this next slide is going to transition us into another factor that leads to increased anxiety. So, as you can see, the mom says, "See, this is called the outdoors." And her son says, "Oh, I've seen this level on my video games." You may have guessed it, it's technology. So, obviously, this is something that's talked about so much right now, which is good. We talk about how much screen time kids should have, what counts as screen time, and so on. So, I'm going to be taking a more neuroscience approach to explain some of the biology behind it. So, when you're on your tablet or your phone, you get a flood of dopamine. And dopamine is the feel good chemical that happens when you eat a cookie or you do something that you enjoy. It's also the chemical that's in charge of addiction. And when dopamine rises, so does adrenaline and cortisol. And these are stress hormones. And they also happen when you go into that fight or flight mode. So, this is why when kids are using their tablet when you're out to eat at a restaurant, they do great and they're behaving well, right? At least until you take their tablet away. Then their dopamine depletes and only stress hormones remain, which leaves them in fight or flight mode. They are going through dopamine withdrawal. MRI studies have shown that technology is, in fact, as addictive as cocaine and nicotine because they use the same neural pathways in the brain. And another concern is when our brain is used to large amounts of dopamine, like from technology, small amounts aren't registering. So your child won't enjoy things like playing a board game with the family or playing outside if they're used to being on their phone a majority of the time. They simply don't get enough dopamine to feel joy. Research has actually found that there is a relationship between technology and an increase of diagnosed mental health disorders. Now, they can't say that technology causes this increase, but they are definitely related. Some of these disorders include autism, ADHD, anxiety, depression, developmental delays, sleep disorders, sensory processing disorder, and speech delays, to name a few. And the amount of these diagnoses are increasing at an alarming rate. So, what can you do now that you have this information? Now that I've scared you all? Balance is key. Okay. I'm not going to sit here and tell you to stop allowing your kids to be in technology because you would all leave this presentation absolutely hating me. So, just create more balance between tablet time and playtime or outside time. And actually, not all technology is created equal. Something I read recently said that watching movies actually tends to be the best due to the in depth plot lines. It can actually help build a child's empathy. And they're typically also less stimulating for kids to watch than a short 20-minute show or being on their tablet. So, the answer to stress hormones when your child gets stuck in that fight or flight mode after you take their tablet away is touch and movement. Because most kids who use technology a lot, like 7 hours a day, for example, don't get a ton of movement. So they become wired for stress. So you want to make sure that you include regular physical activity throughout their day. And touch activates the parasympathetic nervous system, which acts as the brakes of the brain by slowing the nervous system down. This lowers cortisol, adrenaline, those stress hormones, and as a result, anxiety. So the system gets activated with technology and then deactivated with touch, like a hug or a cuddle session on the couch or a simple touch on the shoulder. An important note on teens and technology. We are finding that kids are replacing relationships with technology. They would rather be on screens than with friends or with mom and dad. And actually, teens are more attached to than to their parents, recent studies are saying, which is why parents are finding it increasingly more difficult to discipline them because they simply don't care as much. Kids are also developing a lack of patience because everything in their world is instant gratification. I know I'm someone who struggles with this. If I don't get my Amazon package in 2 days, I freak out. And that's not even as instant as I would like. And two things in life that don't lead to instant gratification are relationships and job satisfaction. And we're seeing that young people are really struggling with both of these things right now. So, our next factor is play. Play is a child's language, and toys are their words. Play is as vital to kids as being able to speak English is to us because kids project feelings and process all the information that they take in throughout the day through play. So, play serves a much higher purpose than just being fun. And studies actually show that kids who play more have better social interactions, higher self esteem, higher empathy, more self confidence, and higher IQs. Play also improves memory, increases attention span, and develops language. In other words, play builds the brain. So when kids play, it activates the entire neocortex, which is the logical part of the brain that isn't fully developed until adulthood. Specifically, it increases functioning in the prefrontal cortex, which is the part of the brain responsible for regulating emotions, planning ahead, and problem solving. So, this part of the brain plays a massive role in the survival response that we've been talking about. Therefore, the amount of play kids get is directly related to anxiety levels. So, to put this into perspective even more, play is a mammal thing. It's not just a human thing. All mammals play. Just think about how much your dog loves to play with you, or when you go to the zoo and you see the animals playing around with each other. And non directive play is best for younger kids. And this is free play that doesn't have any structure or direction. Then when kids get a little bit older, around like 10 or 11, they're going to start naturally preferring more structured play like sports or organized activities. So as you can see, this picture, this is a child's brain on play compared to not. And this is actually from the research out of the University of Illinois. And you can see that almost every region of the brain is activated. Pretty cool stuff. All right, we've talked about what anxiety is and factors that can increase it. So now we're going to move into some fundamental strategies that can actually help you manage your child's anxiety. So, how many of you are guilty of saying at least one of these things to your kids? Mhm. The truth is, all of these statements are pretty invalidating and dismissive. Okay. And sometimes we even know that and they just come out. I find myself even telling my 8-month-old, oh, you're fine, you're fine. And I'm constantly trying to get myself out of that habit. So just think to yourself how you would feel if you came home from a really tough day at work and your partner said to you, oh, just stop thinking about it. You'll be fine. I'm sure you would much rather they give you a big hug and say, I'm sorry you had a hard day today. That sounds really stressful. So let's talk more about communicating with your anxious child. First and foremost, you want to validate your kids' feelings. If you take one thing away from this presentation, validate all day. Okay. What you know your child is feeling, it's very real to them, even if it doesn't make sense to you. Right. So it's important that we show them empathy then too by demonstrating that. And you can demonstrating that you can understand what they're feeling, right? And maybe you can't understand it, but you can at least try to put yourself in their shoes. So saying something like, wow, that was really scary. Everyone gets scared, even grown-ups. And allow them the space to feel whatever it is that they're feeling. Talk with them about their anxiety. We often like to keep it this hidden thing that nobody talks about. Ask them about it. What kinds of things make them nervous? How does it feel in their body? What would be helpful for them when they feel that way? And what can you do to support them when they're struggling? And explain to them what anxiety is and its purpose. A huge part of therapy when I work with kids and even adults is providing a lot of psychoeducation on what it is that they're experiencing to empower them and help them understand what's really going on. Taking away some of the unknown of anxiety sometimes can be enough to decrease anxiety levels. Here are some more specific expert recommended strategies to help anxious kids. So, you want to be their safe haven. You want to be the person that they go to when they're anxious to help them feel safe and comforted. So, bringing in the validation, empathy, and listening are really the simplest ways to do this. But for kids experiencing separation anxiety, which is so common in young kids and even some older ones, you want to help them feel more connected to you when they can't be with you. A couple ways to do this is to tell them that there's an imaginary string that connects the two of you. And if you're not already familiar with this book, The Invisible String, it is a great way to introduce this idea. Bridging to the next connection is an attachment based strategy for separating from a child in a way that will reduce their anxiety and their resistance. So, you do this by focusing on the next time your child will see you, as opposed to having the focus be on the goodbye. So, let's say that your child struggles with anxiety at bedtime, which us parents know is very common. You would say something like, I'll see you when you wake up, or I can't wait to dream about you tonight. Another example is when your child leaves for school telling them, I can't wait to see you after school today. Very simple, but it can be very effective. Another important recommendation is to let kids be kids. Filter out the adult world as much as possible. Kids don't need to know that the world is a scary place yet. So limit the news and access to information and keep adult conversations to adult ears. Overscheduling kids is actually something too that is really common and can be a big cause of anxiety. Studies show that kids benefit most from structured activities, like sports, only beginning at age 11. And this is not to say that young kids shouldn't be in any activities, but you really want to limit it to about one activity at a time. Kids can actually experience burnout, like we can, by doing too much too soon, and that will increase anxiety. I mean, think about how you feel when you have a really busy week and don't have any time to relax. Kids, especially before age 11, need a lot of free time to play to build their brain and to be bored. Being bored is good and really important for development. And finally, let kids cry. Crying actually drains anxiety because you literally cry out stress hormones, adrenaline and cortisol. So, this is especially helpful when they're anxious about situations that they have no control over, like having to get a shot at the doctor, because there's not much that can be done about it. So, let them cry it out. So, how can you help your kids during those moments that they're having a lot of anxiety? All of this is on the handout, by the way, that I sent over to Megan. So, there's no need to write anything down, just so you guys know. The easiest way to reduce anxiety is called name it to tame it. So, you do this by labeling the emotion that it looks like they're feeling. And this will immediately take away some of that emotion's intensity. If you notice your child seems to be afraid of a thunderstorm, for example, you say, Oh, I see you're so scared right now. By the way, you can also do this yourselves. So, this is a tip for any of you who also experience anxiety as well. Another strategy is to put anxiety to bed. So, B is for body and breath because you always want to work with the body and breath before involving anything in the brain because we feel anxiety and all other emotions in our body before our head. You can do this by utilizing progressive muscle relaxation or deep breathing. And deep breathing is super important for anxiety because it helps calm the body down. It's also important to make sure that your child knows how to take a deep breath. You want to breathe in through your nose and out through your mouth. And you also want them to be breathing through their belly, not their chest. And you can look up some really good videos on how to take correct deep breaths. They have a lot of really great ones for kids. And remember, touch acts as the brakes by slowing down the nervous system. So if your child welcomes touch, I'm not telling you to force them to be uncomfortable, but you can put a hand on their arm or hug them to help them calm their body. The E is empathize. Now, I actually recommend doing this first, but then the acronym wouldn't make sense. So do what you will. This can actually be the name entertainment strategy. So you want to label their emotion, give permission for the emotion, normalize it, and listen. So this would look something like, I see you're really worried, and that's okay. Everyone feels worried sometimes. What is it that's worrying you right now? And D is for decisions. So this is where you're going to take the task or the situation that seems overwhelming for them and break it down into smaller, more achievable steps. And for teens, you can even take it a step further and engage more in problem solving some solutions with them. Now, remember from earlier, when a child is anxious, you want to focus on their emotions. But once we've used the previous skills and they've calmed down a bit, we want to engage their thinking brain by using some mindfulness skills to help get them out of that anxious head. So, this is essentially a fancy way of telling you to distract them. These are some really good examples of some good ways to do that. And lastly, avoid avoidance. If you have a child who is nervous to go to school because they have to read out loud in class, you don't want to keep them home. Avoiding things that make us anxious only prolongs and intensifies the anxiety. So that example leads us into our next topic, school refusal. This is a theme that I see often in my office, and I know that this is a big struggle for parents. So you want to start out by just investigating what's going on. School refusal is a symptom of something bigger, and there are a lot of different reasons why it may be happening. So I've got some common ones listed here, but it can also be a symptom of a mental health disorder, like social anxiety disorder, major depression, oppositional defiance disorder, or ODD, or post traumatic stress disorder, or PTSD. And that's just to name a few. So you want to ask specific questions to figure out where their anxiety is coming from. So, what are the most difficult parts of their day? What is their anxiety stopping them from doing? What would they like to be different? Then you also want to explore the positive parts of their day because you really want to try to move their perspective away from focusing on the negative. So, what are the best parts of their day? What does a good day at school look like? Once you've hopefully figured out what's causing the school refusal, you want to develop a plan with your child. And it's really important to involve them in this as much as possible. So you want to figure out what they need to practice in order to decrease their anxiety about school. Maybe it's social skills by learning how to start conversations with new people or taking deep breaths during times of high anxiety, like taking a test. Next, you want to help them identify who is on their team to help support them when they're feeling that anxiety. So, who can they go to both outside of school and in school for connection? Some examples in school could be a teacher they feel comfortable with. Maybe it's their current teacher or a teacher they had the previous year, a school counselor, or maybe even a trusted friend. Connect with them before school by utilizing validation, touch, or talking about their upcoming day and focusing on the positive parts. You want to keep things as low stress as possible before school to really set them up for success. And I know this is something that can be really difficult, the before school crazy, um, but definitely doing your best to make sure that that morning is low stress will be really important. Now, let's say that you try all of these things and they're just not budging. So you let them stay home for the day. It's crucial that you don't allow staying home to be fun. Take away their electronics and make staying home about school. Try to get the work they're missing out on from their teachers, or they probably have access to their stuff so they can log in and do their homework that way. If they enjoy staying home, it will only foster their avoidance of school. And another option is to involve the school if these steps aren't enough. So, create a survival kit at school. What are some things that calm them down? That, again, working with the school to make sure they can bring these things, like a fidget or a stuffed animal that they can bring and keep in their backpack. Develop a safety plan. At what point does a school call you when their anxiety is starting to get really high? Designate a safe place where they can go calm down. Maybe it's simply leaving class to go get a drink of water. Or if they're younger, maybe going to a corner in the classroom that's set up for something like that. And if all else fails, work with the school to develop some more official accommodations with an IEP or a 504 plan. And if your child is seeing a therapist, they may be able to work with the school or write a letter on your child's behalf as well. So, to wrap up, we're going to talk about how to know it may be time to pursue professional help and what you need to know when you do. So, some signs it may be time to find a therapist for your child is if their anxiety is affecting their daily life and if they're struggling to cope with it, or if it's not getting better or it's only getting worse. Okay. And if you've tried the skills that we've talked about and maybe even some other ones too, and nothing is working, that may be sign to reach out to somebody. So, one important thing that I definitely want to mention is the difference between coping skills and treatment. Coping skills help somebody get through a moment of anxiety. So, this would be a lot of the strategies that we talked about tonight, like deep breathing or naming objects in the room. Treatment gets to the core of what's causing the anxiety with the goal of reducing it so their daily life is no longer impacted. So you want to make sure that if you're seeking therapy that this is the goal because while coping skills are important and should definitely be included in your child's treatment plan, sometimes there can be too much focus on coping instead of treating. So, what does therapy for anxiety look like? There are different types of therapy. So, the most important thing is to just find what works for your child and for your family. One of the most evidence based and effective therapies for anxiety is cognitive behavioral therapy, or CBT. And CBT focuses on the connection between thoughts, feelings, and behaviors. It examines how negative thoughts contribute to anxiety and the impact that those thoughts have on our emotions. So, CBT is great because it works for young kids, through teens, through adults. Play therapy is another evidence based therapy, and there's a huge misconception that playing with toys means that the therapist is not helping your child. And I'm telling you that those of us who do play therapy hear all the time something to the effect of, oh, she says all you do is play games the whole time. But as we talked about earlier, toys are used like words by children, and play is their language. And there's a lot of research that backs play therapy up and shows it to be very effective, especially for kids under 10. Most therapists who work with kids will use some element of play anyway. So even if they aren't engaging in specific play therapy, that will likely be part of it. The number one thing to remember about therapy is to find a therapist that your child connects with. It's so important that they enjoy going to therapy. The patient therapist relationship has been shown to actually be one of the most important factors to change and therapeutic success. So you simply won't see progress with a therapist that your child doesn't like working with. And it's okay to try out multiple therapists too before you find the right one. So empower your kids to let you know if they don't like it and advocate for them to work with someone that's a better fit. Or maybe the type of therapy they're doing isn't helpful for them. You also don't need to be experiencing severe symptoms to seek therapy. Anybody can benefit at any time. So, what questions do you have?
Thank you so much. I'm going to go ahead and stop the recording. So give me one moment.